Director General of the Ministry of Health, Dr. Vishwa Mahadeo, while speaking at the launch of the 2021 Rehab Week on Sunday, says that a focus of the Health Ministry is on ensuring that there is an equitable delivery of healthcare services. Cognizant of that focus, he said that rehab services should be provided in those areas where it is not yet provided.
Dr. Fanali, if he sees these pictures or when he sees them, he is going to be pleased. Because one of the things that he said to me personally when I came at the Ministry of Health is that the kind of services that we are offering at or on the coastline, this no less kind of service should be accessible to those persons living in the riverine communities, living in the hinterland, in the far-to-reach communities. And so Dr. Mangar told me that these services are being offered in the villages of Region 9, of Region 1, of Region 7, and I am happy. But we still have to get to Region 8. And so let us make that. I know that you've already got the staff ready to go, but let us make it happen this year. Let us make it happen this year. Before the end of the year, Region 8 also has got to have access to those services.
Importantly, Dr. Mahadeo said that these rehabilitation services intersect all other specialties in medicine. Some of these rehabilitation services include physical therapy, occupational therapy, speech-language pathology, behavioral therapy, and cognitive therapy. And he said that each person will need these services at some point in their life. As such, he commended the local rehabilitation team for the work they continue to do. Meanwhile, Director of Disability and Rehabilitation Services, Dr. Arian Mangar, related that this year, Rehab Week will be observed under the theme Rehabilitation in the Frontline during the COVID-19 pandemic. She said that this theme was particularly apt since those who provide rehabilitation services have been on the front lines striving to provide patient care.
Our rehab personnel have been working on the front line during COVID-19 and are responsible for maintaining essential services. In these unprecedented times, as you are aware, COVID came, but people did not stop having strokes. People did not stop having their feet amputated. People did not stop having spinal cord injuries. Our kids, with disabilities, the disability didn't go away. Hearing aids, people did not, their hearing didn't come back miraculously. So life went on and we needed to provide essential services.
Dr. Mangar also said that some 1,800 patients who received care at the COVID-19 Intensive Care Unit ICU also received rehabilitation care from her team of rehabilitation workers. Physiotherapist Angelica Holder spoke on the challenges of working in the ICU.
Right? There's so much uncertainty around there. Like sometimes I will be working with a patient and I'm thinking, awesome, you're gonna get better. We're doing so well. I'm gonna see you tomorrow. And then you come into the unit and you hear this patient passed away. And honestly, having to go through that over and over, it's exhausting. And at the time, it was like, am I doing the right thing? Is my work actually paying off? There wasn't much interventions established at this time. You didn't have much information. You didn't know. No one in the world knew. Everyone was just here, just trying to figure it out too. But you know what? What really, really helped was having a team of physios with you. Having someone to inspire you. Having your director go into the unit first. And she set the example.
As part of Rehab Week, the work of these health workers will be honored. It is also expected that through various foreign symposia, more people would become aware of the work done by the local rehabilitation team. Reporting for the newsroom, I am Vishani Raghabir.